The annual open enrollment period for 2026 ACA health coverage starts November 1st in most states, and consumers who plan to shop during this enrollment window should be aware of changes that could affect their 2026 individual and family health plan options. One key change is that health insurance premiums are expected to rise significantly in most states. Rate filings submitted by ACA Marketplace health carriers project an average premium increase of more than 20% over 2025 premiums. And that's just full price premiums. Most people get a subsidy, and unless Congress takes action soon to extend Marketplace subsidy enhancements that are scheduled to expire at the end of 2025, premium subsidies for Marketplace health plans will be smaller than they would otherwise have been, and some people will lose their subsidies altogether. If that happens, after subsidy premiums will be much higher in 2026. Second, a new federal rule has increased the upper limit for ACA compliant health plan out-of-pocket costs. That upper limit is rising to $10,600 for a single individual in 2026. Another potential change to watch for is that carriers are pulling out of the Marketplace in some states, meaning some enrollees will need to select new coverage for 2026. But in some states, new carriers have decided to enter the Marketplace and offer plans. So these carrier changes can result in changes to premium subsidy amounts, as well as different plan options available to consumers in different areas. A fourth change for Marketplace enrollees who would like to contribute to a health savings account is that all bronze and catastrophic Marketplace plans will be HSA eligible starting in 2026. And that's a big change, as most Marketplace enrollees have historically only had a small number of HSA-eligible plans available, or none at all, depending on where they live. For 2026 coverage, it will be especially important to make sure that you're projecting your income as accurately as possible, and then keeping the Marketplace updated during the year if your income changes. That's because if your subsidy ends up being too large, there will no longer be a cap on how much of that excess subsidy you have to repay to the IRS. You'll have to repay all of the excess. So these are just a few of the factors that make it really important for people to start thinking about their health plan options and make sure that they're comparison shopping during open enrollment. You can find out the open enrollment period dates for your state and learn more about changes for 2026 coverage by clicking on our 2026 open enrollment guide in the video description below.